Two more hospitals have reached a tentative deal with nurses to avoid a strike, but 5 hospitals still have not. And that means 10,000 nurses could still walk off the job on Monday. Now, some of those hospitals are taking drastic steps to prepare, including moving sick babies. Eyewitness News reporter Sonia Rincon is live on the west side with the latest on negotiations. Sonia?
Sade, Mount Sinai West is one of 4 Mount Sinai hospitals across the city taking those steps. Mount Sinai is still negotiating with nurses, but at the same time bracing for the impact of a potential nurse strike. Its nurses are among the 10,000 citywide who could walk on Monday. They still haven't received the working conditions they have asked for in writing, and the clock is ticking. So far, 3 out of 8 hospitals have reached tentative new contracts with their nurses: New York Presbyterian, Maimonides, and Richmond University Medical Center. The New York State Nurses Association is urging the remaining 5 to do the same, taking aim at one in particular, accusing it of paying executives nearly $28 million in salaries, bonuses, and perks at the height of the pandemic.
If Montefiore can afford to pay its executives so much, they can hardly cry broke.
Montefiore is one of 2 major hospitals in the Bronx, still negotiating as it gets down to the wire.
The concern is if there is a strike, what will Montefiore and Bronx Care do to supplement the staff that is on strike? And so we are asking those questions. We're, certainly working with the leadership of both hospitals to make sure that there is a plan.
The borough president says she's optimistic it won't come to that.
And many of our nurses that serve our Bronx residents and families are women and women of color. So it's deeply personal to me as a woman and a woman of color. And I want to make sure that the leadership recognizes not only their importance in practice, but certainly when it comes to contract negotiations.
Nurses maintain their biggest issue is working conditions, nurse-to-patient ratios, and staffing levels necessary to prevent the burnout that drives nurses away from the profession. The ratio numbers they want vary by facility and department, but as an example, they say right now, nurses in Mount Sinai's neonatal ICU are caring for twice as many babies as they should be.
That's not a safe nurse-to-patient ratio right now, Mount Sinai. You need to do better.
Mount Sinai says it's preparing for the possible strike by diverting ambulances, beginning to cancel some elective surgeries, starting to transfer patients to other hospitals, and working to safely discharge as many patients as appropriate. Now, both Mount Sinai and Montefiore say their offers, similar to New York Presbyterian's, were rejected. When asked why, the union said, well, some hospitals have put the staff ratios in writing, but not the mechanism necessary to enforce those ratios in the contracts. We're talking about 3-year contracts. When you think about 3 years ago, New York City and its hospitals had not yet experienced the global pandemic that thrust nurses onto the front lines and into some of the most difficult moments of their careers. So needless to say, a lot can happen in 3 years.